And we're live. Good afternoon or good morning or good evening, depending on when you're watching the show. If you're watching live, we want to hear from you. This is Marianne Spears Carr, and this is the Healthcare Leadership Show, my weekly show where I get to highlight and host some of my network and who are doing amazing work in the field of healthcare and are really leading the way in terms of what's been going on out there. Particularly today, we're going to be talking about really interesting story about an Atlanta-based company that is doing an incredible work around working with physicians to make a difference in labs and making a difference in the care. Today's topic is RX for Outcomes and Value, the Aegis Health story. And my guest today is Noah Hansen, the president of that company. And Noah, you and I have got to know each other over the last couple of weeks. It's a pleasure to have you on the show.
Thanks, man.
Please introduce yourself a little bit better than I did. Glad to have you.
Yeah, no, I appreciate it. Noah Hansen, co-founder of Aegis Health Services. We focus on basically incorporating clinical pharmacy into value-based care outcomes. So I started in the industry in preclinical with a health system here in Atlanta and kind of cut my teeth learning how healthcare innovation gets done, and just didn't stop. So I eventually founded this with a couple of partners, and we've been at it since 2019.
Over the last few weeks, I've gotten an opportunity to get to know you through one of my longtime contacts, Doug Gregory, and became really excited about the work that you were doing. And as I was preparing for our conversation, I was really starting to pay attention to what is the patient population out there? What are the problems to be solved from your perspective? And for those of you who don't know me, who are watching the show for the very first time, my world is executive recruiting and leadership development and business advisory services for healthcare companies all across the country. Been doing it for a very, very long time. I'm also Georgia-based, even though I'm from North Carolina. I live up in the mountains of Georgia. But one of the things that I've been really tracking is the whole movement of value-based care and what the problems it is really trying to address. And when you and I got to meet and talk, I got really excited about the difference that you're making in patient lives by the process that you deliver and how you partner with the physicians and the care delivery companies that are out there. Could you give us a little more insight around what is it that Aegis does to address the changing landscape, and give us a background on that? And by the way, if you're watching live, please let us know in the comments. We want to know you're there. One of the things I love about this show is that we get to engage with people. And if you have questions for Noah, please post them in the chat and we'll bring them onto the screen and have a conversation. Noah, can you give us a little more depth on what's this problem that you really solve with this company?
Yeah, I mean, I think in short, when we all see this coming, right after COVID, there was this intense focus on, solving one problem that really obviously was targeted towards the most the sickest of our population, and instead of solving one, we created 1,000 others, because those people are high risk, multiple comorbidity, and instead of managing those conditions, we focused on something that effectively made everything else worse. So what we found was, obviously founding the company just before COVID and having to get through that you've got this high risk geriatric population that is on multiple medications, and they're constantly being forced back to a primary care, though they're obviously interacting frequently with specialists. And everybody kind of just tosses that football back and forth, because whenever some problem comes up on one side, they're going to tell you, go back and see your cardiologist, go back and see your primary. And in the end, the patients, these are people who don't have, medical degrees, trying to learn why they can't take two drugs at the same time, whether or not it interacts poorly with the device, why they're having this, that, or the other side effect. And so what we really figured out was that you've got to incorporate clinical pharmacy into these care solutions, because it's not enough to just say, hey, let's manage your diabetes, let's manage your congestive heart failure. People who are dealing with all of the above needs someone who can quarterback that care, communicate, and interact with the providers. And obviously the goal is get better outcomes. You want people to actually like live better, longer, and with that complexity, that's harder. And so our focus is find points in the industry where we can interact and cause immediate benefit. Infectious disease is an easy one. So interacting with the physician, ordering a lab, resulting that infectious disease panel and giving them better antibiotic guidance. That's kind of a basic one. But also looking at, your high risk population and, just going from the standpoint of like, you're on all these meds, what appropriate, testing is maybe out of date and you need to reorder. What medications do you need to consider, whether or not this patient is actually taking them. And we've got stories of, obviously people get their meds reviewed on a regular basis. But if anyone sits there and asks them, like, when was the last time you got this refill? They might say, well, it's been 3 months. And a clinical pharmacist is going to catch that. They're going to say, it's impossible for you to have these side effects if you're actually taking this primary med, because that's what it's for. And they're like, well, actually, I can't afford it. And this copay is very expensive. And it's just a much more like, you need a hands-on approach. There's obviously technology that goes into play there that we've developed, but it really does boil down to giving these clinical pharmacists the opportunity to coordinate care the way that they were kind of designed to, but where there just hasn't been a bridge to that solution. And so we see ourselves as that bridge.
I love that. And when I got to, I visited your offices and met with some of your team there, and they told me story after story like that. Checking in, let's check in. Melanie Heights checking in from Auburn, Alabama. Dr. Hassan is checking in from Bangladesh. This is, by the way, I didn't tell you this, Noah, but my show is international. Gus Eckstein's checking in from your offices at Aegis headquarters. Glad to have him. Melissa Evans is checking in from Trophy Club, Texas. And by the way, Melissa, I'm not very far from you right now. I'm in the Dallas-Fort Worth area. Charles Hall's checking in from Atlanta. Jason's checking in from Decatur, Alabama. We have Niku, and I can't pronounce your last name, checking in from Atlanta. A whole bunch of people checking in. So it's just great. And thank y'all for being here. And if you are watching live, let us know. And if you have questions for Noah, please post them in the comments, because my show, the Healthcare Leadership Show, is interactive. We want you to engage. We want you to be involved. And the more I got to learn about what you guys are doing, Noah, one of the things that stood out was something you just pointed out, was the fact that, yes, there are proprietary technology platforms and approaches that you guys have developed and use, but the human piece of it, you and I had this conversation. I'd love for you to talk a little bit more about how having that partner, having that pathologist, having that clinical pharmacist, being able to work with the physicians, where that human-to-human discussion, it becomes far more collaborative than just an AI algorithm figuring out that you might need to do these protocols. There's this connection between the people you have in your organization, the team that you have, and the physician, and of course, the patient you just mentioned. Can you talk a little bit more about why that is such a game changer for what y'all do?
Yeah, and I think this is kind of a basic element of how, like, the push towards AI and algorithms answering complex questions. It seems like a great idea. There's a number of regulatory hurdles that are going to exist there, because healthcare is not going to be fast to adopt taking away the physician's responsibility in making a medical decision. So, and that's just not how healthcare is structured. I mean, we are very subspecialized at this point. So whenever you've got a problem, there's, you don't just go see a cardiologist, you see an interventional cardiologist, and so I think the natural progression that we looked at was, yes, you need software or you need tech-enabled solutions, but there has to be a professional component where you're able to interact with someone who's got the skill and experience and has had enough, repetitions in the space to say, hey, this is what we're seeing. This is what we think your options are. These are your alternatives, that a doctor can actually get on the phone once they, get results and say, I'm also dealing with, this level of acuity on this patient, is intravenous an option? you're like, we all want the best care for these people. And if you're doubting whether or not a technology solution is giving you that, then you're just not going to use it. So our focus is really in a technology enabled, but still professional, like scenario. And so I think there's an obvious way that works, but we focused on incorporating clinical pharmacy because there's just so many of those people out there who are looking for opportunities to support patient care, and obviously they need a platform and able to do that, and that's what we provide. So in a
Love that. And I love, I keep saying I love that, but one of the things that's really exciting, I think, from the pharmacist perspective, which you just mentioned, is this idea that they're trained to do this work, but because of the models that have been traditionally placed in hospitals and across the the different various sundry forms of roles that they play, that's not. Matter of fact, I can even think about, as a patient myself, how few interactions I ever had with a pharmacist, right? Maybe when I was getting refilled, I didn't have those interactions, and that's really really valuable. More people are checking in. Golzar is checking in at Farm D from California. Speaking of pharmacists, Gil Hope checking in from Savannah. Maxine, Austin, Texas. I'm down here in Texas myself. Prim's checking in from Houston. Got Chattanooga on the board. We also have Alex, another one of your team members, checking in from Sandy Springs, and a whole lot more. Thank y'all for being in the discussion. I would love for you guys in the comments to share with each other, any thoughts you have around this. Noah, one of the things that that we didn't prep for, but I wanted to talk to you about is when I had the opportunity to get to know your team there. You have assembled an incredible team and really deep in their knowledge base and their commitment, et cetera. But one of the things that really stood out was they really have a heart for this work. And as I got to know you a little bit over the last couple of weeks, I see that as well. Talk a little bit about kind of what is the heart of Aegis Health Services? What does that look like you've talked about the patient outcomes perspective, you've talked about supporting the physicians, giving clinical pharmacists and professionals the opportunity to make direct impact with patients and have that engagement. But one of the things that really struck me about the company is this heart for the work. Could you talk a little bit about kind of what set the foundation for that, and how do you drive that, and how do you sustain that?
It's kind of funny because it's a faux pas in all startups, but you have this like everybody's trying to change the world story that people like to tell. I do think what we focused on was like creating a culture inside the company where you look at healthcare, and I mean you're talking about $17 trillion annually, a massive percentage of GDP. Like boiling the ocean on healthcare is a big ask, right? And so no, I know a lot of people go out there and they want to claim that that's what they're doing. And our the way we looked at it was, can we actually impact not just like the outcomes that patients are looking for, but the bottom line on the carrier side, because we all know that this system has got massive financial concerns. And so building a team that understood that there's a patient's outcomes component. There's a technology concern around that. There's regulatory. There's the payer concerns, like understanding how physicians function, and there are things that they will and will not do. It took quite a bit to like kind of get the right team of people in place that really are enthusiastic about affecting meaningful, measurable change in the system, and I think that's what we've done. There's if you think of just just incorporating a gig workforce model on the clinical pharmacy side, I mean that's not something that's really been done in healthcare. I mean, obviously there are temp agencies, and there are contracting opportunities for those people, but giving them a platform where they're actually able to make a meaningful difference, where on the technology side you can measure that. I mean, you need a group of people that really understand data, which in healthcare is not very clean, know how to know how to get to the solution without gumming up that person's time. Everybody wants to do the work, but if it takes you 2 hours to do it, that's not really acceptable. If you don't have adequate data to make a better decision, those are things you have to bring in from disparate sources. So we've got a great team in-house that, focuses on making this as kind of like, making it as beneficial to all parties involved, which does include the clinical workforce.
One of the things that I also observed, again, got to hang out in your office a little bit, get to observe that is that part around cultivating the clinical professionals that you do, and the team that you're developing there, and continue, like you said, it's kind of been a work in progress, and evaluating that. For a pharmacist out there, let's talk about workforce for a moment. For a pharmacist out there that would want to get into this type of work, what are some of like the traits that they would need to bring to the table? Not necessarily saying you're hiring right now, but you talked about how you remodeled this into this kind of gig economy perspective. What are those aspects? In other words, what do you look for in a clinical pharmacist to fit within this model?
Yeah, right now, I mean, our big push is in infectious disease, and so that tends to be a fairly specialized clinical pharmacist, and those people usually have extensive experience reviewing molecular results, of whether it's respiratory wound, there's UTI. Those are people that we look for on a regular basis. And like I said, they fit in that gig model. So it's based on what time they have available, when we're, pushing results out, and how, whether or not there's going to need to be an interaction with the ordering physician. So we're looking for, we look for people who have obviously the knowledge, the skill set, and then, there's got to be some bedside manner involved too, because no doctor wants to be told what to do. They want a collaborative team environment. And so that's what we try to bring in, is individuals like that. We look at, just gene to drug and drug to drug interaction, guiding physicians who might have to push that patient back to their primary or back to a specialist and say, I don't want to operate outside of scope. I need somebody to help me make this decision so I can treat this patient, but they've got issues that need to be resolved with another provider. That person's really got to have that kind of like tact, in order to say, hey, we're making a recommendation to, reduce X or prescribe Y. And, we think it's for the best of the patient based on what they're currently experiencing at this other specialist. I mean, it takes a skill set. I do think there's a lot of clinical pharmacists out there. Some of them are looking for more experience in the space. We try to provide that. And we have we've got tiered options for people with varying skill sets. But we try to, provide all additional training and support and make sure that the software itself is helping you do what you do without having to go and, Google what to do about the X drug or Y, or, finding different resources. We try to embed those resources in the solution.
You just logged in, maybe missed the beginning. This is the Healthcare Leadership Show with Marion Spears Carr. That's me. I'm Marion Spears Carr. For those of you who don't know me, I am an entrepreneur myself, an executive recruiter, leadership development person, and a lot of other things, advisors to companies. And when I get a chance to bring people like Noah onto my show, when I get a chance to highlight companies like this gets exciting. And if you're interested in learning more about the Healthcare Leadership Show and how you can be highlighted and how we can connect, please connect with me on LinkedIn, drop me a message, and I would love to have that conversation. Noah, one of the things that I learned too in meeting with your team there is the work that you guys are doing from those in relation to cancer and oncology. Could you talk a little bit about how you support that side of the patient work that's being done?
Yeah, I mean, in the gist of it, and this does go back to the whole value-based care story, is that you've got people who are, kind of have some sort of, they're focused on a specialist because of a problem. Cancer is an obvious one, and they still have issues resolving. Whether it's their kind of chronic conditions, and managing those people and supporting that physician. Like I said, they don't want to focus, they don't want to function outside of scope. So the second that they have an issue, their only solution is to say, hey, go back and see your primary, when obviously that patient's just hoping that they can get as much resolved as possible with the doctor they're seeing today. So one of the things, and this is what we see kind of as the future of healthcare and where it's going, we all know there's a physician shortage coming. We all know that there's a push to move things towards, nurse practitioners and mid-levels. And I think that the way that this is going to work is you're going to have this greater coordination of care in order to support the acuity of this population, because they have limited access to specialists in the rural scenarios. They're going to have fewer access when, with varying specialties, experiencing massive shortages. And so the way that we see this working on just the outcome side, and then eventually on the risk, the payer side, when they're trying to reduce the total cost of care, is somebody has to take responsibility for where the rubber meets the road. In our mind, where the rubber meets the road is your medications. If you have one thing in common with anybody with any condition, there are meds involved. There's testing involved. Somebody has to look at that. Someone has to, and what you don't want is for that person to say, well, hey, we've gotten this far with you, in oncology, but now you've got to go back and see your cardiologist because this is a problem that I can't handle. Like, putting those patients on that merry-go-round, in my mind, is just not fair. Creating an ecosystem whereby you have this better collaboration and where there's like true coordination of care, it's just going to give them, it will truly give them better outcomes. And that's the data that we see. On the payer side, then what you're going to see is, you're not going to go back and run the same test 4 times over, because, we're starting from zero every time we see another provider. Mm-hmm. You do need people to be able to say that we already have this information. This is what we recommend. And obviously you're a doctor, you can make your own medical decision, but now you've got a support team that's actually going to make sure that this patient's just not out there, in the wastelands trying to find their way, which, we all know that's currently the scenario.
When you think about, also, you mentioned the number of doctors that's a challenge. Like, from a workforce perspective, again, as you mentioned, the higher use of APPs, changing delivery models of all types. One of the things that I think we might have mentioned it when we talked the pre-show, but one of the things I've been tracking and paying attention to is how the care delivery models are changing dramatically. A lot of my clients are healthcare and hospital systems that are trying to deal with all these different challenges. And one of the conversations that was really taking place in 2020 with the pandemic, 2021, was the hospital at home movement, where these high acuity patients are going to be treated at home. How does Aegis Health Services fit into that model, where not only are we dealing with, obviously, patients with higher acuity, which we've already talked about, but now they're in a different environment? I'd love to hear a little bit about that.
Yeah, and we've worked with multiple groups in this space that are putting nurse practitioners into the home, and some of it, just anecdotally, what you see is it's very hard for them to go in with a problem list, find out that there's new problems, and still try to focus on managing existing disease states, right? So if you're showing up at this patient's house, they might have memory issues, there might be some significant fall risk. Yeah, it's hard to cover that when they've got a persistent UTI that now needs to be dealt with immediately. So just being able to provide that extra layer for a nurse practitioner who's really out there doing their best, trying to make sure that this patient is going to stay out of the hospital, not going to have to run through another specialist. I think, and this is just our, the way that we see the industry moving, is like, you do need that extra layer of support, as if you were in a hospital system, as if you had that, you were doing rounds and you had all the resources necessary to make the best decision. That's what you really need to provide for those people. And that is the future. That's who's going to be treating, the highest risk patients in, that out there is going to be your nurse practitioners who are on the front lines. And need as many resources as possible, we see ourselves as that resource. So helping guide, like, you've got a duplicate therapy, you need to rerun the comprehensive metabolic on this patient. They've got impaired renal function. Those are all things that, it's hard to make that decision when you're trying to sort through, your fourth patient of the day in their house with whatever it is they're dealing with, who might not even know who you are when you knock on the door. I mean, these are people doing really hard work.
Mm-hmm. Yeah, and Melissa's making a key comment to that, and we're facing that in my household right now too. She said, "I commend what you and Aegis are doing." She's experienced the scenarios you've described while taking care of an aging parent. A lot of us are doing that. My father passed away a few years ago, and fortunately, my whole family was kind of involved. But now we have an aging parent, my wife's father, and he's healthy right now, but down the road, how are we going to manage that? So I believe the information you're sharing, and Melissa, thank you for that comment. I think that population and all of us, and I'm not that young, I may be one of those patients down the road myself. So
yeah, we all will be. It's happening. So
yeah, it is. No, who needs to connect with you? In other words, my network is you and I've talked. It's pretty big. It's not great, but it's pretty big, and I have people in healthcare delivery models of all types: home health, long-term care, acute long-term care, traditional hospitals, physician practices, etc. Who needs to connect with Aegis? Who are the key people that need to connect with you guys now to learn and understand more about how they can get involved, how they can connect,
right,
and create these kind of outcome opportunities?
Yeah, obviously we have a significant focus on long-term care, skilled nursing, levels of acute care. I think the other side that, we're making a push into is supporting, your high-risk outpatient cardiology. Those are people trying to figure out how to implement guideline-directed medical therapy. And for them, it just doesn't fall into a priority when you've got higher reimbursing lines of service that they're trying to capture. And in the end, we're all businesses. So, we try to focus on where we add the most value, not just on the patient side, but also to the other businesses we support. If you're a hospital system trying to, prevent readmission and, you're not getting the type of support you need from that primary because no one's doing that post-discharge work, that's a scenario where we play very well. Obviously, if in the home-based care model, like we've said, I mean, there's a lot of groups going out into that space, and trying to include technology is great, but additional resources like us that can be layered in without having to incur additional boxes to check on that nurse practitioner when they're in there seeing that patient. I mean, nobody wants more work during the day when they're already trying to see a full load of patients. So that's kind of anywhere where guiding medication decision making is beneficial. That's kind of where we see ourselves. So post discharge, long term care, and then your high risk specialties that are obviously now being put on the hook for quality and don't really have the internal resources to support those types of workflows.
What's the future look like for Aegis? I know you guys, and not to give away the ship or anything like that, but give away your proprietary stuff. But sure. You mentioned a couple things there. Where is an area that you guys are focusing on that might be like, oh wow, we really need you in that area as well? That might be something that people are thinking about that I didn't even know that was possible to work with somebody like you guys.
Yeah.
Any area like that?
On the immediate side, I mean, obviously your high complexity molecular testing is an easy one for us. I mean, that's going to be a big focus for us over the next, say, 12 months is just, impacting that market. It's been fairly inundated with algorithms, which are coming under scrutiny from the FDA. So being able to give that type of guidance against your complex molecular testing is an easy one. I think the future for us really does focus more on the value-based care reporting, because in the end, if those patients have, if they're basically being given the appropriate high complexity diagnosis, then their budget is better. There's less prior auth concerns for them. and that's going to make the industry, kind of work better as a whole. So it'll eventually drive down costs. That's what the numbers show. But in the end, you still have to provide better care. And so that's where we see ourselves going, is pushing harder into the value-based care space.
Well, I told you this was going to go by fast. We're up in the 30 minutes. I told you it was quick. We had a lot of people in the chat. Thank you for being here. If you watch the replay, please also let us know in the chat, because we want to make sure we know who we're connecting with. And if you look, I'm going to post Noah's LinkedIn connection in the chat. Also, Doug Gregory, who introduced me to you, one of my longtime friends through the Georgia ACHE and through a lot of other reasons, was the one that introduced me to you. He's the Senior Vice President for Business Development for you, and he's the one that got me excited about what you're doing. He posted in the chat, so reach out to Doug. Noah, thank you for being on the show.
It was a pleasure. Really appreciate it.
Great conversation. For those of you, if you're not connected with me, I would welcome you to send me a connect request. I'm Marion Spears-Carr. I run a company called Inflow Executives. We are an executive search, leadership development, and business advisory services company based in Georgia and Nashville. Glad to have you watching today. Thank you for being with us. Hope you all have a great rest of your day, and we will sign out now. Thank you so much for being here, and I look forward to staying connected.